Hello, dear colleagues. Good morning, good evening, good day. Hello. My name is Mynzhylky Berdikhojayev, and together with my colleague Rowan Ayteli, we are from National Hospital of the Presidential Affairs Medical Center. Presidential Affairs Administration of the Medical Center in Almaty. And it's just simple Presidential National Hospital. Bacht is operating nurse, Kulgayshay is anesthesiology nurse, and the video support from presented by video Case-1 company, Evgeny Grishayev in the control room, and the second nurse is Arzegul. And second nurse is Arzegul. And the case number 1, we have a patient with the MCA Aneurysm on the territory of left MCA, and now we are doing diagnostic angiography first. My wire anatomically in external carotid territory, which is more safe territory for the navigation. And if you use diagnostic catheters, then your diagnostic wire for the exchange maneuver usually addressing into this external carotid before changing for the guiding catheter. Yes, thanks to Shimon Maimon. He's our teacher. He's the teacher of Kazakh interventional endovascular neurosurgery, and we learned diagnostic angios in that manner. We are doing it with the guiding catheter, which is now 6 French. The guiding catheter is Judkins Wright 6 French Klimber from Teruma company, and it's inside the 6 French guiding sheath, which is 90 centimeter, 90 centimeter diagnostic catheter, guiding catheter, 90 centimeter, and 8 French sheaths for the more comfortable navigation, which is Prelude from Merit Medical Company. We usually use this setup. Okay. Where is the left? Okay. Okay, now I understand. It's an anatomical variant of the aortic arches. The first is coming right subclavian, then comes common carotid, right, and then left carotid and left subclavian. Now we should go to the ascending aorta. Anatomical aorta. Yes, now inside the родной пересаж. It's the roadmap. Okay, it's not a roadmap. Smart mask also. Okay, smart mask. Stop. Okay. Okay, this is the left side. It's an anatomical variation of the aortic arch. And let's place it here. It's the advantage of using Neuromax. When we use the Neuromax, there is no need directly go with the inner catheter. It's possible to place the Neuromax, which is outer catheter, navigate it through the sheath. Okay. Stop. Okay, I think this 3D angiography could be better for the understanding. Okay. Second. Интересно. Yes, it's a MCA fusiform aneurysm. Patient presented with headaches. Yes, there are several possible options of the anatomical clinical presentation of these aneurysms. But in this case, it's headaches. Okay. Let's do 3D angiography. Бақтанар, стойкалардың бәрін қарап қоя салыңыздаршы. Тик қалмасын. Okay. As I think this 3D angiography may clarify the anatomical variation. Yes, it's okay. Okay. Пока. Okay. As there is one branch coming from the aneurysm, which is going to the temporal territory, another temporal branch. That's why it's like this, huh? Okay, let's do it like this. Yes, it's something like this, I think. Okay, it's quite nice landing zone, and let's measure the whole length. Measurement. because of all these outgoing branches, I think it's better to start somewhere here. That's 3D, huh? Okay. Something like this. It's more than 30 centimeters, huh? 274 to 48. We have several options for this case. The option number 1, I think something like this, as this branch is going from the aneurysm. It's possible to put some coils in the proximal part. In this part. The artery in this point is 8 millimeter. It's nearly 15 to 60. Okay, what we can do? 3 millimeter. 6 in this way. I think the classical AP is also okay. Let's see. Yes, we can start something here, maybe here, and then go down to the branch. This is the normal MCA. $82 жермотет болды, каудально. 85-24. Okay, let's see how it would be. 85-24. Okay. Ah, it's a cranial. Okay. Thank you, Rowan. Okay, 85-25. Okay. Okay, let's see how it would be on AP. Which projection is better? It's something like this, huh? Or something like 36, 37. Okay. Okay, let's take this like this. Okay, let's see. Something like this. Okay. was 80, something like this, no? This one is something like this is ACA, I think something here, huh? This is ACA and this is MCA, and this point is free from branches. Okay, let's see MPR. As this is a distal branch. It looks like only this branch is coming from the distal part. And I'm looking for the possibilities to place several coils here. Huh? Should we place several coils or just flow diversion? It's a dilemma, huh? Okay. This is the MCA. Okay. Let's measure here. It's entry point. This is another. Okay. This is a entry zone, 3.7. Approximately it will be 3.3 millimeter. And distally, I think this 3 millimeter. Yes. We have two options. Option one is Leo baby. Bach. Leo baby Kroksnalber Persage. We have 324 LVC was stand and 3 millimeter Leo baby stand. Окей, Leo baby разгледим, да? Head on jet пересос. Так, и обычный чекай пересос. We will take headway 17, чекай, and for coiling we can use 27 microcatheter. Вести толстый артион да янковите. Сон тължисълц. Ашер, Нена, аш пресъл Neuroslider Germagita. Okay, and we will take Neuroslider 27 for the as a coiling microcatheter. Так, bunu basın. Burmaya koysa da tratın сияқты. Жоқ, пай тұра беретін сияқты. Окей. Так, и екі вай коннектор ашасыз. Мынау спиральға. Біреу ашаңыз, біреу. Okay, we'll take one microcatheter for stenting, which will be 17 headway, and then it will be так, и бір система. И біреу жетеді.
екеуге. На, сал.
Женщина самот.
На,
Бақыттан системаны жалғасың.
Бесте тоғыз пенумбраны спиралін ашып бересіңіз. И Little Baby қоямыз, LBCL қоямыз. Қайсысы дұрыс болады? Okay. There are two options how to open the Leo Plus, Leo Baby Plus. One is from proximal to distal. The second is from distal to proximal. Okay. Yeah, sure. Так, и Leo Baby Leo Baby дұрыс па, Ева дұрыс па? Үште 24. Okay. This is for coiling. Coiling catheter we will place on the second. 3.25. Тұра тұрыңыз. Ашпай тұра тұрыңыз. LV7 тройка қайсысы бар? Жоқ. Шарым, да? Анау қазір 1 секунд. Okay, let's measure the... That's at 3.7. I think the baby is better, huh? Okay. Leo baby ашасаңыз. Хорошо. Гепарин... Шумын салатыз.
Гепарин шум. 3.25.
The device is quite stiff, huh? Basically like this. Кондиционер 24-ке қоясаш, бақ. Кондиционер 24-ке қоясаш. Yes, there are two options of opening the Leo baby. The first we can start distally, and the second we can start from proximal and then may continue to distal. Which one is better? Huh? Okay, let's see how it will navigate. Ну, рахмет. Okay, it's all full. Лорноксикам жасайсыңыздар?
Обезболивающие. Ладно, да, все пока жасайсыңдар. 16 жасайсың. 16.
Okay, it was an old methodic we learned from Shimon. It's a 0 centimeter, and now we need, it's a 3. We can start something here, then 25 will be here. Okay. Okay, let's open the first and then we can open the second. And the first we'll open distally. Okay. Yes, and for the French people it was marked like this. We should go this direction. And it's better to follow the instructions. No? Yes, unfortunately, the coiling catheters 17, we have several, which is the last from last year, and we're waiting for new tender. Italy. We're waiting for new tender, and it's a governmental medicine. You dependent from tenders. Huh? Okay. It's not bad, but it's not so good, huh? Okay. As then patient is covered by the insurance system. There is some limits, but it's okay. For the patients it's okay, but for the completeness of the treatment it might be a little bit challenging. Huh? Okay, we can start something here. Лишний раз солить не относится. Yes, it would be maximum opening. No? It would be maximum opening because of the artery. Okay. Let's do the other. Timer. We can place the timer. Okay, distally I think not bad, plus minus. Maybe we can open a little bit distal, yeah? But I think it's okay. Option number 1, we can open it. But option number 2, we can place a couple of coils proximally and then can fully open the stent. It's a Penumbra piece 400 coils. Тағы бір пятерка ашып бересіңші, бақыт. Питер. Пятерка спиральдер бар ма тағы да? Қанша бар екен? Екеу ашып берсеңіз. Я екеуін де ашамыз. Yes, it's 4x9. Итер. I think we need a proximal support, that's why we decided to take these coils. I'll bring my catheter a little bit back. It's lying like this, huh? It's going this way. And going this way. There is a branch this way. Don't need so much this way. Okay, maybe we can bring it a little bit back. It's quite soft coils, huh? Okay, I understand. Okay, now we can push the system inside the aneurysm. Yes, it may include the branch we talk about. Okay, I will take back the coil. Now we'll open the stent maximum. Okay. I need to go distally. As this point is better, but better to go a little bit distally. Okay. This looks like it's went, huh? Okay. Okay. Let's take the second little baby. You can smell it. You can smell it. Leo baby, wacht.
Wacht.
Yes, I think we need one more proximal, one more distal, and the last one will be in between, huh? Okay. There is one more option. It's possible to place the flow diverter stent inside. Арик стравот разъяс насосно. Без аспирина, хорошо? И тренер. We check the verify now for this patient, and PRU is very nice. That's why it's possible to keep the patient without aspirin on single monotherapy. Жаңағы неге қоясыңшы? Референс. Родно қоясың. Такие противочные. Дальше следующий. Предыдущий. Стоп. Okay. As the distal part is also needs the stent. But let's start from proximal, then we can go to the distal part. Okay. I think it's good. We can start something here. A bit proximal. Okay, I think we could anchor the baby. Okay, it's good, it's better. Tā broj naš persas. Deļosni. Giorgio, baby. Baby. Okay, it's still attached.
Левую беги, сжимаюсь. Отводом.
It's a half-half rotation. And then we'll try to push the whole system. It's pushed inside the aneurysm. Okay. Now the proximal part is still in M1 segment. Let's see what we can do. The system is pushing now. I think it's still attached to the... Okay. Maybe at this point we can place a couple of coils, huh? To stabilize the system. No. We don't need distal placement, we need the proximal placement. Huh? Okay. I think it's too soft. Too soft. Okay, let's check. This is a branch. This is a branch 85-34. $85.34. Okay, let's check how it's look like. Because of all this kinking. I'm just okay. The catheter is too stiff, that's why. I tried to bring the catheter. It's placed. It's pulled the whole system on. Okay, the point number 2, there is no marker. There is no marker, second marker on headway, on Aeroslider 27, brake marker. Okay. I think it's a little bit proximal to the branch. I think this is the branch, huh? It's not like it's a branch. Okay. Okay, smart mask. Yes, it's quite stiff micro catheter, narrow slider. That's why it's behaving like this. It's okay. It's okay. It's going all the times there. Yeah? Didn't hold it. It's placing all the time at one place, huh? Not proximal, it's going all the time distal. Okay, let's try to pull it. Maybe now it's better. Okay. Şimdi tamam. Ana веткадан алыспы? It looks like it's not touching, huh? Okay, let's try to replace. The delivery system is a little bit damaged, that's why it might spontaneously detach. And I don't want to place the coil on the upper wall, but it's all the time going there. Okay. Okay, now it's better. Huh? Now it's better. Okay. Now it's placed as we wanted. Okay, let's see what we have on the upper wall. Huh? It might be. This is a straightening artery. It's quite distal. Oh, it's not the straightening artery. Might be this one. Small one. Right, David Calvert. Контраст.
Бағыт.
Okay, it's look like okay. Could we detach? Let's push it like no. Okay, detached. Так, нулевой родмок пересол. Right. We'll place several coils, then we'll reposition the headway inside the stance, and then we may continue. Okay. Oh, there is a problem. It's not possible to push. I couldn't push. I don't know why. Yes. It was impossible to push. Just a second. I don't know what happened. What's this? It's impossible to push. Oh, it's detached. Okay. What we can do next? Okay. The coiling is not a good idea with narrow slider. Yes, it's quite stiff device. Okay. Okay. Let's leave the last coil on the table. And narrow slider. Okay. It's too stiff, huh? Okay, let's continue with the stenting. I think now the position of the stent is quite okay. It's interesting. Okay, let's place it. Okay, I have seen it last time in India when we tried to take out the wire. It was stuck with the anchor. Yes, that's why it should be very, very careful. Okay, now I think it's better. Okay. Let's continue with the stenting. This is option number 3. Yes, we have now the position of the little baby is nice. The last baby is quite distal. The second one is inside the first one, and we may place another one. Huh? Which one is better? Okay, let's take. Stent açmış. 3'te 22. 3'er 22. Спирали. Готово? Açtın? Okay. Okay, we have little baby more. Okay, we have one more little baby. Thank you, Rowan. Okay. Yes. The alternative in this case is bypass and trapping. Huh? It's an alternative. Okay. It's a complex anatomy, and yes, maybe one long 40 millimeter flow diverter is also an option. Okay. Okay, can start. It's still inside the previous baby. I think now it's okay. Yes, it's not bad. Okay. I think it goes outside. Huh? Okay. Oh, it's okay. Let's see what we can do. Она срёлась по этому ряду.
Бахот.
Сен неге осылай жүріп жатыр десем просто сүре қосылмаған. Жаңа последний ангиография жасап. Смарт маска. траксас пересаж. Let's take the traxxas. Yes, we need to position a little bit distally the traxxas were. I think now we're inside the stent. We're inside. It's outside. No, we're outside. Снаружи. Yes, now we're inside the center. That's better. Okay. Yes, now we're in the limit. Okay, let's check it. Not an easy case, huh? Okay. Бақыт, мына 3,5-17 деген стендті тоже ана жаққа бұрып қоясыңызшы. 3,5-17 и Ева. И 3,5 бірдеме дегенді ашып бересіз қазір. Ана үлкен ұзындығы бар ғой, соны ашып береміз. 3,5 22. 22, біреу. 3,5 22. The stent number 4 is this EVO 3.5 22 millimeter. Var mı? Окей. Итер. Скорее всего, на маркер тұрған жерден бастап ашсақ, как раз келетін сияқты. Итер. Кірді ма? Кірді ма? Окей. It will be shrinked. So at this point we can start to open. Yes, now stent is opening. Check the control engine. Now it starts stagnating. Назад. Стоп. Вроде нормально. Okay. Now we can open completely. Yes, stent is opened. Okay. On lateral we can see the markers. Yeah? Okay, I think we can place one more stent. One more stent will be placed proximally. Yes. Бахтева. Жаңағы ашып бересіңіз, шарман жеді. Okay, it's stent number 5. Huh? Let's place it proximally. And I think the second treatment will be in couple of months. Все враж. It's again LVCO. Экранды бір 20 сантиметр тартасашы өзіне қарай. Бақыт. Экран 20 сантиметр тартасам. I think now we can start to open the stand. Нашел двоечник. It's a braided bridge, huh? Вперед. Okay. Okay. We will leave this construct. And I hope in a couple of months we can place FD inside. Okay. Start stagnating. We are working so long, huh? It's more than 1 hour after first stand. Yes, the whole stands are opened. Now we have 5 stands. Okay. Yes, it's a fusiform aneurysm. That's why everything is like this, huh? Okay, let's check. Аяқтың басын қимылдатып көріңізші. Окей. Все хорошо. Окей. КТ-ға қой бер. Қалайсыз? Басыңыз ауырып жатқан жоқ па? Шамал басылды ма? Жана құлаған кезде сәл ауыру мүмкін. Қазір басылады. Жақсы ма? Енді бір 5 минутта Құдай қаласа бітіреміз. As patient is okay, let's wait for the control CT and then we can decide. We can do final decision, but I think the next treatment will be in a couple of months. Okay, let's wait for CT control. CT is ready. Let's check the CT. This is proximal part of EVO. It's inside the MCA. Then it goes to the distal part, and brain is clear. Yes, it would be the step treatment, and the next treatment we will plan in April. It's February, March, April. Okay. Patient is okay. She's feeling good. Okay, see you in next 20 minutes. Next case is ICA stenosis. Okay, thank you.